Welcome to the Darcy Wellness Show. This week we're going to be covering fitness and exercise, and my name is Geoff Darcy. I'm an acupuncturist and herbalist, and with me in the studio is Dr. Kouch. Dr. Pheng Kouch is a chiropractor at the Darcy Wellness Clinic, and also with me is Eric Beard, who is a licensed massage therapist, a personal trainer, and a certified trainer. Welcome, guys. Thanks for joining us today.
Thank you. Thanks, Geoff.
Talk on fitness. So, Eric, just give us a little bit of background on your work. I know that you're into some exciting work. You've got a lot of postings on YouTube. You've got your own CD sets out on teaching trainers on how to train other people to get fit. Can you tell us a little bit about your series?
Oh, yeah, that's great. I've been involved in the health and fitness industry probably since 1996. I kind of started in my undergraduate, and my whole quest along the way is, exercise helps you feel better, helps you move better, helps you live better.
Right.
And not only learning lessons about my own body and learning from other professionals like Dr. Kouch and yourself along the way to really understand what a balanced program is about. But then I learned that most people, as they begin to undertake an exercise program, probably aren't quite as ready to handle the rigors of a program that they think they are.
Yeah.
So thus the kind of corrective exercise. It's almost preparative work that we do with people so they can run a 5K, so they can lift weights, so they can play tennis recreationally without a lot of the itis coming up. So I've spent my time learning how to help people as a massage therapist and corrective exercise specialist be able to do the things that they love. And there's no better way to learn something than try to teach it. So for the past 8 to 10 years, I've really focused on teaching other people in the industry.
So that brings up an interesting idea that you're really involved in every aspect of working with people's fitness, right from somebody that walks in. You work at the Longfellow Club here in Natick, and right from the very get-go, when somebody walks in completely unfit, say, okay, I've got to do something. What do I do? All the way from the absolute beginner to you work with the USTA, the tennis federation, right?
Yeah, I've done some work with the USTA with some of their top juniors in New England. I've also done some work with the Chinese Tennis Association, where I've gone and worked with their top junior coaches and their top juniors. I'll be back there again this year. But for when we're looking at the high-end athletes, we're really looking for those kind of roadblocks or performance inhibitors, those things that aren't symptomatic, like a tight ankle or a shoulder's not moving right, that can really affect performance. But we do get people that haven't exercised at all before, and the same rules apply is that the body needs to move right. So once we kind of go through that intake process, sometimes through just exercise alone, we can get them where we want, but we do encourage integration of things like acupuncture, chiropractic care, physical therapists, massage therapy, or just traditional wellness care to get people where they want to be.
So if we could go to our first slide. So, Dr. Kouch, why is exercise so important, just in general? I mean,
well, like Eric said, exercise is all about moving the body, and moving the body is crucial to living a healthy, well-balanced lifestyle.
Right. And if we could go to go through some of these points here. So physical activity is really important for good health, especially if you're trying to lose weight. Everybody kind of knows that you have to exercise to lose weight, but also to maintain the weight loss. Most people are active during the weight loss process, but there again, to keep it off is extremely important. And the idea that, of course, it's reducing risk, the risk of cardiovascular disease, the risk of cancers, all the way around, depression, cardiovascular disease, the whole gambit of diseases mostly are helped by fitness, by exercise. I read an interesting study the other day that showed that you can add 4 years to your life. And it was an English study, and it was basically by adding 4 factors. One factor was, having 5 portions of fruits and vegetables a day. The other factor was not smoking. Moderate drinking, which in England I'm not sure what that would be, and the fourth factor, the fourth factor was, of course, exercise. That 20 minutes a day of exercise was part of these very simple 4 factors, and they went over 20,000 people over the course of a decade, and they averaged out the average increased longevity based on these 4 factors was 4 years. So it's pretty phenomenal that you can increase your health like that and reduce your risks. So let's talk about the absolute beginner. Somebody walks into your club, into the Longfellow Club in Natick, and says, okay, Eric, I want to work, and I want to work without getting injured. How do I get fit? What would your answer be?
We almost never get that. It's usually, I want to lose 10 pounds, I'm going to do it by next week. No one wants the slow and gradual process, but that's where we have to start. Is it all starts with the assessment, just like you would with a licensed professional with Dr. Kouch yourself. You really have to realize where someone is. A lot of times they use the MapQuest analogy. I know people are probably more towards Google Maps now, but if you look at MapQuest, on one side you've got the green box that says start, and on the other side you've got the red box that says end. So you have to be very clear on where someone is in relationship to where their goals are, and then be very specific with that. And once we understand what someone's emotional drivers are for trying to achieve their goals, what their fitness is in all aspects of their body, then we can start to create an individualized strategy to get there. And one of the things that my staff does very well is they look at movement. They look at the balance of muscles around joints. They look at coordination and strength. So we don't just throw someone on a treadmill or put a giant weight in their hands. We want to see how well they move, talk about their health history, talk about their experience, and try to come up with an individualized program from there.
So I'm sure that somebody gets motivated right from the get-go. Given that most Americans, 66% of Americans are overweight, so you get somebody gung-ho walking in the gym saying, okay, I'm really going to lose those 10 pounds. There's all kinds of injuries that can come from that. So your initial assessment is what joints are going to absorb the most shock, could be potentially injured. How do you start them off? I mean, how do you say, okay, we need to do 20 minutes a day, or on the treadmill, on the exercise machines? How do you begin with an absolute beginner?
You know, there are a few ends of the spectrum. For the people that come in to see me, they're either very focused on achieving a goal, they're an athlete that's looking to really take their performance to the next level. They probably a referral from a professional such as yourselves or a coach. For those folks, I'm doing a much more in-depth assessment and going joint by joint for range of motion. So their corrective strategy is going to be a little bit more specific. The average person, we're going to take those concepts into mind, but we're going to make sure that we're starting with a flexibility program to loosen up tight muscles. You know, we know from 21st century living, you know, we weren't meant to sit like this, like a giant rotting cashew at a desk, as we weren't meant to do that. So what we have to do is we have to start to undo that from some flexibility.
A giant rotting cashew at a desk.
Just take the picture in your head, get out of your desk and walk around. Okay?
It's pretty intense.
Get up, get a drink of water, move. So we want to have a flexibility program and a core stability program, the small muscles around the spine, so this guy doesn't have to do so much work putting the bones where they're supposed to be. And then we integrate the general cardiorespiratory and strength training guidelines. But the basic nuts and bolts are the flexibility and core stability, which helps improve posture, which someone can then tolerate strength training and then tolerate general walks or low-impact cardiorespiratory training.
So, you know, so going back then to what does that look like? You know, after you've made that assessment, absolute beginner, say 20 pounds overweight, wants to lose 10 pounds, what kind of things would you suggest for them?
We're going to have
often?
Yeah, we're going to have about 5 to 7 minutes of stretching at least each session, hopefully up to 10 to 15.
So before anything happens, stretch.
That's it.
And we know that athletes are terrible at getting them to stretch, right? Maybe the professionals do, but most of us weekend warriors don't, or most people are remiss about that.
Geoff's smiling. He's not guilty of that at all.
I'm just thinking of my tennis group. The guys I play with tennis, you know, nobody stretches before they play every time.
Yeah, flexibility would be first.
So like stretching for 10 minutes, then
some 5 to 10 minutes of core stability. Then
what does that mean?
We might have exercises that are similar to some yoga poses where we're focusing on like doing a bridge, like lifting the hips up and down to condition the glutes.
Yeah.
Or some exercise where we concentrate on moving the arms and legs where our spine stays still.
So it's not just get on the treadmill or
do a
on
bunch
the
of
elliptical
crunches.
machine. Isn't it? It's a little bit more involved than that.
Absolutely.
More balanced.
And then, you know, and if we do have someone on an elliptical trainer or something that's non-impact in many cases, that's best for them. And then we do encourage them to, so that's kind of in the gym. And then there's some strength training, you know, not like a big heavy weight, but just getting the body to move. And then on their home program would be hopefully stretching 5 to 10 minutes a day, doing core stability exercise for 5 minutes a day, and then the general health concepts of taking the stairs instead of the elevator and parking further away and then walking.
So do you use pedometers in that to try to get people to measure how many steps they're taking during the course of the day?
We do. I got mine on right here, so if mine beeps in the middle.
How many have you done today?
I've done 4,998 steps, so not very good because we're shooting for about 10 grand a day. So
is that what you're looking at? That's the average steps?
That's the average recommendation that you'd like to see, and that can be a challenge to get. So thank goodness for walking my kids to school and walking the dog. That's the only way I get
So somebody as fit as you are, working in fitness every single day of the week, still needs to be, you still get some motivation for yourself from the pedometer?
My wife will laugh at me on the rare occasion that I actually fold laundry. I do laundry, but I don't fold it. But I'll be walking back and forth. She's like, "What are you doing?" I'm like, "I've got 950 steps. I got to get 1,000 more to get 10." So absolutely, it's just that little kind of angel on the shoulder. It's just like what you would recommend for a lot of your patients and what they should and shouldn't be eating, and having warm tea versus cold water at times are things that Dr. Kouch would like to see his patients do. It's that element of accountability. So a pedometer is a great way to do that.
So if we could go to our next slide now on the exercise in general. Going back to the image you've implanted in my brain of being a dried up cashew at a desk. So the idea of a magic bullet is that really exercise is involved in every part of our wellness to maintain our weight, to reduce blood pressure, reduce the risk for type 2 diabetes, reduce risk for heart attack, stroke, several forms of cancer. You're looking at reduced risk for arthritis pain and associated disability, reduced risk for osteoporosis, and then the attending not falling as much. So with the elderly, it's super important. And reduce risks of symptoms of depression, anxiety, and even insomnia. Now, if that were a drug, if you had one thing and that to treat all of those diseases, prevent all of those diseases, it would be a phenomenal success on Wall Street. It's so simple, just to exercise, and it's reaps such huge rewards. How do you get people motivated?
That's the trick. Is motivation is external and fleeting. It's got to be inspiration from the inside. As people have to be ready to change, and then they have to be willing to dedicate themselves to the discipline of caring for themselves. It's just like drinking enough water or eating the fruits and vegetables like you mentioned. It's easy to do it for a week, but it's to do it over a period of time. And that's why a health and fitness environment sometimes is really encouraging for folks, because you have other people kind of going through the same plight, or whether it's a walking group or
a wellness. We do wellness work at the Darcy Wellness Clinic with corporations. So going into a corporation, actually getting people to wear a pedometer, to start charting their steps, to be able to do it as a group is very inspirational. It's kind of a lot more fun.
And it's a lot different between, hey, let's go ahead and fire up a pizza for lunch, or instead, well, I got to go for my walk today. And it's not just one person doing it, it's the entire group. So there's a social component that can be quite powerful there. And when you're addressing wellness, it's the entire part of the circle, not just, well, I'm going to walk and lift weights, but I'm going to smoke cigarettes too. It's trying to balance things out.
So Dr. Kouch, on the other end of the spectrum, I know that you've done work with professionals. You were working with the Breakers for a while, the soccer team. And so high performance. So as a chiropractor, you must see, as Eric was sharing about putting stress on certain joints, you could see the whole balance of the body, that they are like a racehorse. They will perform better if the structure is in alignment, if the muscles are all working better. How do you assess somebody, it's different from, say, a weekend warrior or somebody just starting off in fitness. An actual athlete, how could you help an actual athlete improve?
Well, most athletes who come to a chiropractor aren't going to come because they'll usually come when they're having symptoms. So usually we'll start off by doing global range of motion, trying to assess what joints may or may not be affected.
So a global range of motion would mean?
So just having them bend forward, trying to touch their toes, extending back, going side to side.
So actually taking measurements of how far the joints can expand or not expand. If they can
and
rotate
looking for asymmetries and trying to find those asymmetries and correcting the joint function in that area, as well as addressing the soft tissue in that area, which is crucial to proper athletic performances.
And so the idea of a common injury for a soccer player, heading the ball might be compression in the cervical vertebrae in the neck.
Very common, absolutely. So what we'll do is we'll do the range of motion assessments in the neck. We'll do orthopedic tests to rule out any other, other causes, or any nerve impingement, or anything that may require something other than chiropractic manipulation for that case. But most of the time, we're able to address it chiropractically and with the soft tissue work, and help it out that way.
What does soft tissue work look like?
Soft tissue work, what I do in particular, I do a technique called active release technique, ART, and it's a technique whereby you are essentially massaging a muscle, but at the same time doing motions directly focused at those muscles to get that range of motion, to break up the adhesions within those muscles. And
so the idea the adhesions are kind of trapping the free-flowing movement of a joint.
Yeah, adhesions can be likened to kind of muscles that are kind of sticky, if you will.
Yeah.
So we're trying to break up those adhesions, trying to unstick the individual muscle fibers from one another. And the active release does.
So how about, say, a baseball player, a pitcher, comes to you to have better increased performance? You'd look to see if there were any adhesions, so the motion would be more fluid, if the structure was in balance.
Sure. With a baseball player, for example, a lot of times they're throwing balls, so a lot of times you'll see rotator cuff injuries. What you'll also see is a lot of scapular issues. So working and addressing the scapulothoracic joint and making sure that there's this fluidity in that joint so that there's not so much strain on your rotator cuff, for example, would be a big part of addressing
so they won't
a player
blow
like
out
that.
the rotator cuff and
Exactly.
and have a longer period. So it's preventative, basically.
A lot of it is preventative,
Yeah.
absolutely.
Yeah. Great. If we could go to our next slide, the idea of, there's a difference between exercise for fitness and then exercise for health. I mean, fitness is, Eric, would you make a differentiation between the two, that exercise and fitness? Fitness kind of has a connotation of really trying to push it and increase muscle tone, build muscle, build performance, stamina, whereas, exercise just in generic might be more about just 20 minutes at lunchtime instead of the pizza.
Yeah, and that it kind of comes back to the approach that someone's going to have towards exercise. Exercise is really only loaded or repetitive movement. So walking is a movement that's repeated, or lifting weights is just exercise that's with an external load. So what we want to do is we want to make sure, as you had mentioned before, that we provide enough stress or challenge to the body to see some positive benefits. In some cases, that's just burning calories. That's going to help us get rid of stored fat. In other instances, it will help strengthen muscles as well as the cardiorespiratory system to be able to complete certain tasks in a time frame like an athlete would. So there are definitely goals that are different, but we have people that come into us for basic health and fitness goals, but over the periods of months and years begin to train a little bit more like an athlete. Doesn't mean that the risks are higher to their joints, but what their heart and lungs and muscles are able to do really changes over years. So we're beginning to get back to what we were supposed to be able to do before the advent of technology and being seated all the time.
So if we could see our next slide now. So the benefits of exercise, so there's less chance. We've covered some of these points before, and if we could go on to our next slide. The aerobic exercise is something that you work with. How would you define aerobic exercise?
When we start to look through textbooks, it's just telling us it's exercise with oxygen. So once we go for more than a few minutes, it's going to require oxygen to keep doing that. And that's where there's almost a bit of a myth out there, is when we're just talking about health. It's we're brainwashed to think that we have to do 20 or 30 minutes of exercise for it to count. But when we start looking at prevention of heart disease, stroke, cancer, we're looking at accumulated activity over a period of a day. So even if it's 5 or 10 minute spurts, those walking up and down the stairs rapidly, or walking your dog, or jogging to catch the train or the commuter rail, those things kind of add up over time. So when we're talking aerobic exercise, I would just say that that's something that's repeated for more than 2 minutes. That's just kind of a personal explanation for that. But it can be much different than just tying yourself to a treadmill for 30 minutes and
going. So when you coach an absolute beginner, you're trying to get so many minutes of exercise, let's say in a gym or in a kind of a controlled environment, but you're also then coaching them to take the stairs, park further away from their office than they might, get off a stop or two earlier from the bus, so you walk a bit more. So it's really the total package that you're trying to inspire them into. It's
tough in Natick, though, because when you miss this and you end up at West Natick, it's a lot further away. I've done that before, taking the commuter rail. But yeah, I mean,
at least you get your steps in for your pedometer.
It takes about 3,500 calories. We have to burn about 3,500 calories to get rid of a stored pound of fat.
So let's cover the calories again. Then, I mean, that's a pretty frightening figure. Let's have that again. So 3,500 calories is a pound of fat.
Right, and the average person that we see, if we look at the work that's going on a treadmill, they're going to have a 20-minute bout of exercise on a treadmill. They're burning about 120 to 150 calories. And then they're drinking a Gatorade that's 2 servings, that's 150 calories in the bottle. So they burn 120 calories, they drink 150 calories, they gain weight on the treadmill. So you don't need Gatorade
It's pretty
on
depressing.
the treadmill. It is very sad. So just forget it and don't exercise. No, just don't drink a Gatorade unless you're outside sweating playing tennis with Geoff. But we do want to accumulate that balance of calories is by looking at burning 200 to 500 calories a day with exercise, and then adjusting your food intake throughout that, and then you can begin to add up and say it's really a mathematical equation. So all the little things with extra activity, and then being very focused in a gym. And the big thing that we focus on is, what do you have to do to be able to walk without your knee bothering you, without your back bothering you? Anyone can get in shape in a month, but are the sore spots going to start to stop you from doing that?
So the idea then of somebody taking 10 minutes to stretch, 20, another 10 minutes. Did you say, was it 10 or 15 minutes of a core exercise? And then after the core, what do you recommend people do?
It depends on the individuals. For some people, we would have them go right into their cardio or their strength training. In the real-life application of it, it's what do you, whatever you like least, that's what we do early on. So if you can't stand to do cardio, get the cardio out of the way. If you don't like to do weight training, get it out of the way. We always go through that recipe of kind of flexibility for a warm-up.
How many minutes of cardio would you recommend to a beginner?
It would be, we have to get them on the treadmill to help figure it out.
Yeah.
It's easy to say 10 minutes, but I've gotten someone on the bike and their legs were burning so bad after 2 minutes, they were begging to get off. I'm like, sir, it's been 2 minutes. I didn't make them stay on until 10. I let them get off and get a drink. But what we did is we walked around, we did a couple stretches. We did one strength training exercise. We came back to the bike for a minute. We repeated and came back. So we accumulated 8 minutes of cardio that first day.
Right, sneakily, by sneaking in the walk.
But people get depressed. I can't do 10 or 15 minutes. It adds up. Do it for a minute or two. Push yourself. A little burn in the muscle, a little breathlessness is okay. We'll talk about exertion in a few minutes. But then rest and recover and come back. So it's nice to say 10 or 15 minutes, but we have to really look at where someone's at and just look at that as a success. It's
individual, but going back to the formulaic approach, the idea of stretching and then core and then 20 minutes a day of some sort of movement. On top of what you might be able to get by missing the train and getting off the bus earlier and walking on the stairs.
That would be great. I mean, if we look at the National Weight Loss Registry, those are people that have had significant changes in weight loss, and there are 2 things that they've done on a regular basis, and that's just how they eat and move more. And it's a basic formulaic approach, like you mentioned, and doing it every day.
If we could go to our next slide. The next slide is about taking pulses. Now, oftentimes when you're in the gym, you see people taking the pulses. What have they been coached to do, and why are they doing it?
It can be a little challenging, but there's a process. Is we have a maximum number of heartbeats that we can reach healthfully, and for every year that we age, we lose a bit of that capacity. So when we're counting the number of beats per minute, we're actually finding out the percentage of our maximum heart rate. And with that, you can just find the pulse in your wrist or in the neck. The neck's
what would the average be, let's say, for somebody middle of the road?
The average American is going to be somewhere around 75 beats per minute resting, and if you're going to be somewhere around 65 to 75% of that, someone's going to slaughter me with the math here, but you're going to be right around 135 beats per minute.
So your target goal to increase your pulse rate is up to from 75 up to 130.
Provided that you have no prior health issues or are not on a beta blocker and you've been cleared by your physician to participate in an exercise program, but within that.
Did your lawyer tell you to come?
Yeah, I got it in my pocket. But I think the next slide, the rate of perceived exertion is really a biggie. And I honestly, for my clients who are serious about changing their weight loss or improving their athletic performance, I strongly recommend they get a heart rate monitor to really make sure that they're exactly where they need to be. What I find out is most people either don't work hard enough or they work way too hard. They end up kind of getting stuck in this kind of zone of inefficiency, when if we just balance out their program and focus on different heart rates on different days, it can be more specific. But
let's cover the RPE, the rate of perceived exertion, which is the next slide. Maybe you could tell us a little bit about this slide, the idea of perceived exertion.
Yeah, great way to think about it. For someone who's a beginner, starting off around that 4 or 5. So a scale of 1 to 10. If 10 is you're working so hard that you're going to throw up or you must stop because you're going to pass out, we don't need to be up there. If if number 1 is kind of getting off the couch to get a Gatorade out of the fridge, it's probably not enough. We want to get somewhere around that 4 or 5. something you'll be able to tolerate for more than 10 minutes.
Yeah.
That's a good gauge.
So it's a self-scale, basically. You just rate yourself, getting up off the couch to get a beer and a hot dog versus, throwing up because you were exercising too hard. Between the middle of that is somewhere you want to hang out.
The talk test is a good way to look at that. So if we're somewhere around that 4 or 5 on the scale, you can say a couple words, maybe not finish a sentence, you can carry on a conversation. Once you get up around that 6 or 7 on the scale,
yeah,
couple words, person next to you is annoying you, probably want to stop talking. Yeah. And when you get up around that 8 or 9, when you slow down enough, you get enough energy, you're going to knock out the person next to you because they're in your ear and they won't stop bothering you.
Right. So that's the danger zone. So, Dr. Kouch, when you're working with more elite or more, actually, you don't really have to be an elite breaker or soccer player, the breakers team, even just high school now gets pretty intense. So how often when you discover adhesions or when you discover something wrong, do you refer out to somebody like Eric for corrective exercise or for massage or...
Exercise, physical therapy, things that are going to strengthen the core, like Eric was talking about, are crucial to maintaining pain-freeness.
Yeah. Keeping them in the game.
Keeping them in the game, exactly. When patients come in, usually we'll treat them a series of visits, probably 6, 8 visits or so. And for the most part, we're able to get them pretty much back to pre-accident, pre-injury status. But it's maintaining that pre-injury status that's crucial. Why did they become injured in the first place? What was going on previous?
What set them up?
Exactly. Yeah. What kind of activities are they doing that are causing these things in the beginning?
And if I can get someone to go through that 6 to 8 series, seeing someone like Dr. Kouch beforehand, makes our job so much easier.
Yeah. So Dr. Kouch at the Darcy Wellness Clinic, chiropractic extraordinaire, thank you very much. And basically there's a place for an athlete for prevention with chiropractic and fine-tuning of their game.
Absolutely.
Great, thank you. And Eric, thanks very much for your work with massage and training it in the Longfellow Club. And anybody who has half a mind to get fit or to get fitter should really work with somebody, would work with you or be referred to somebody through you.
Thanks
so thank you very much for joining us. My name's Geoff Darcy from the Darcy Wellness Clinic, and this has been the Darcy Wellness Show. Thanks very much for joining us.